The next talk is given by Dr. Lombardo, Biomechanical Response of the Cornea following deep lamellar endothelial keratoplasty.
Thank you. Good morning. During the last years, deep lamellar endothelial keratoplasty has demonstrated to provide excellent results for patients suffering from corneal decompensation. On the other hand, no work aimed to analyze detail the changes in the curvature profile of the cornea following the surgery. For this reason, the aim of our work was to investigate the early biomechanical response for either the anterior or posterior corneal interfaces following a large incision DLEK technique. For this reason, 40 eyes of 40 patients were introduced in the study and followed up to 6 months after surgery. All the patients underwent a complete ocular evaluation, including orb scan topography. Then, all the orb scan raw data were exported in a custom software for processing. The average preoperative and postoperative maps for the anterior and posterior cornea and the corresponding difference maps at each examination interval were calculated. This in order to analyze the mean response of the cornea to the surgery. At the same time, the corneal reference frame was subdivided into 2 corneal regions as shown, the central region with a diameter of 6 mm and the peripheral regions. This in order to analyze the local response of the cornea to the surgery. At the end of follow-up, no significant changes in the spherical equivalent refraction, nor in the refractive astigmatism have been determined. Also, the best spectacle corrected visual acuity improved in all the eyes. Here are shown the average keratometric tangential maps for the right and left eyes of the study groups. Following surgery, no significant changes in the keratometric tangential maps nor in the keratometric astigmatism have been determined, with difference lower than 0.4 diopters in the central cornea. Also, the topography configuration showed to become more regular during follow-up. Here are represented the pre-op and 6 months post-op average maps for the posterior central cornea. Here we measured a significant increase in the astigmatism power in compare with the preoperative state. This table summarizes the mean pre-op and post-op corneal data for the anterior and posterior cornea. You can note that no significant changes in the anterior cornea have been measured, whereas a significant increase of 0.8 diopter in the astigmatism power of the posterior central cornea has been determined. As regards the corneal thickness analysis, a significant thinning in the central cornea has been measured, whereas this was not the case for the peripheral cornea. Deep lamellar endothelial keratoplasty has given rise to new scientific and clinical questions on the biomechanical properties of the cornea. To date, it is widely known that the corneal tissue the biomechanics of the corneal tissue is strongly dependent on its stromal architecture. Different studies have reported differences in the histology and biomechanics between the anterior and the posterior cornea, with the former having a high stiffness and a main importance in maintaining the corneal profile. Since DLEK represents a unique technique in which only the posterior cornea is removed, it theoretically preserves the anterior stroma. So, in our work, we demonstrated how removing less than 1/3 of the full complement of collagen lamellae limited to the posterior stroma did not significantly affect the original surface topography nor the biomechanical stability of the corneal tissue. In conclusion, we confirm the lesser contribution of the posterior stroma to the biomechanical properties of the whole intact cornea. At the same time, the maintenance of the anterior corneal integrity and the corresponding maintenance of a normal elastic model in the tissue may explain the minimal changes occurring in corneal shape and surface topography after surgery. Of course, longer follow-up studies will bring us additional information on the remodeling of the posterior donor cornea, as well as on the biomechanical stability of the corneal tissue after this type of procedures. Thank you very much for your attention.